take the opportunity to say thank you to all of you who have joined us today for this session, and I know that you're going to walk away with some increased knowledge and that we're going to have made a difference today. As you know, at DHL for Her, we really encourage people to develop their knowledge and to learn about things. And for us, our webinars are one of our really important touch points where we can reach out and connect with you in real time and share information. And in this particular case, information that could possibly be life-saving for everyone. So it's really important, you know, because talking about breast cancer has generally been quite taboo over the years. And the fact that nowadays we're so open about it and that we're having these conversations is one of the most empowering things, really. And it's empowering not only for us as women, but it's empowering for men too. Because I think the really important message that always gets missed is that breast cancer affects men too. It affects all of us, whether as a sufferer or as a supporter of someone who is suffering. So it's really important that we understand and develop our knowledge on this topic, especially considering the endless debates that we have across the continent, you know, where we talk about the state of public health systems. And we know that, you know, in different countries in Africa, we face a lot of different challenges around this topic. And it's really, really incredibly sad because on the African continent, more than anywhere else in the world, the socially deprived people are dying from treatable and manageable diseases. And breast cancer is one of these treatable and manageable diseases. And I guess that's really brings home the point as to what our theme this year is all about. And our theme centers around two elements, and that is making the time to be breast cancer aware, which is what each of you have done today by choosing to join the webinar, and also to remind everyone that early detection saves lives. It's a really scary and sad fact that breast cancer still, other than skin cancer, remains the most commonly diagnosed cancer in women. And the numbers are as scary as 2 million cases of breast cancer diagnosed worldwide each year. 2 million people suffering from a disease and millions more suffering with them as part of their circle. So it really has very broad and far-reaching consequences. I'm really excited today that you guys have joined us, and we have a host of special guests that have got such incredible experience and such incredible stories to share with all of you today, and I'm really looking forward to that part too. So thank you for taking the time to join us. And before I hand over, I have got a note from Henny, who apologizes and extends his sincere apologies for not being able to join us today. Unfortunately, he's a man with many demands and his diary had a clash, but he has given me a message that he'd like me to share with all of you. So I'm just going to read Henny's message to you guys. And Henny's message says, our pledge as DHL Express SSA is that we must continue to stand as one against breast cancer. Our breast cancer awareness webinars are an important touch point for us, as our people are the heart of our business. Healthy people are motivated people. And my hope is that everyone will heed the call to do their annual breast cancer screenings and to do their annual medical checkups. Whilst COVID-19 has really been the dominating and overriding force in our lives, as we've all been trying to not get infected, we must not neglect our physical and our mental wellness as well. It's important that we acknowledge that there are those who are continuing to battle against this dreaded disease of breast cancer long after the color of pink is replaced with our holiday rush and our peak season and all these other things that are going to overtake our concerns. So remember, please continue to obtain information from credible sources. Remember that knowledge is power. And more importantly, remember that your physical and mental well-being is your responsibility. So get the knowledge and do the checks and stay safe. So on that note, I want to hand over to Cara Noble from CANSA, and she'll introduce you to our guest speaker today. Thank you so much, everyone, and welcome, Cara.
Thank you so much, Fatima, for the warm welcome. And from CANSA's side, I can just say that we are just so grateful for the opportunity to be here today, as well as our partnership. It was definitely the start of a really exciting new partnership between DHL and CANSA, and we are really excited to see where this will go as a long-term partnership. So thank you again for having us and for partnering with us. So basically, I would just like to do just a little bit of background. We have really fantastic speakers for you today. We've gone to a lot of effort, and so is your team actually, to make sure that we only offer the best for you today, no matter where you are. And I will be introducing them shortly. We also do have our tech team. We have Emmanuel from EP Digital. He's actually behind the scenes for us today, making sure everything works. So please just bear with us. Since the Africa specifically, we are reeling off the fantastic situation we're in of load shedding. We are on level 2 though from today, so we are very happy about that. But we know that sometimes some of our speakers could be affected. So please bear with us, and we're hoping this won't have any impact on today. But if it does, we will carry on and still make sure you have an enjoyable experience. I'd also like to introduce you to behind the scenes, our head of marketing, Lucy Bologna. She'll be managing the chat box, so don't be shy. If there is something that you'd like to post, or for example, if you are listening to the first speaker and something pops in your mind, please don't be shy. We'd love to hear what you're thinking. And at the end, we'll make time to answer all the questions that were posted in the chat box as best as our ability. So thank you so much for a little bit of housekeeping. My name is Cara Noble. I am the head of corporate affairs and CANSA's TLC Children's Service. I'm also a social worker, and I've been with CANSA for 10 years. And I'm so excited to be facilitating this webinar today with some of my really fantastic colleagues. I'd like to start with Abida Steenkamp. She is a cancer community field worker. She's actually a breast cancer survivor herself, and she volunteered for CANSA for 7 years before she actually was then diagnosed with cancer. And then she actually felt in her life that she wanted to come back and actually work for us as an organization. And for the past 3 years, she has been working for CANSA full-time in the field, supporting patients, giving hope. And she's just been the most incredible addition to our workforce and such an impactful person with our patients on the ground. She is based in Cape Town and is also a very qualified social worker with years of experience. And we are so grateful for the contribution she has made, and we know that you're going to be touched by her story today. So welcome, Abida. We're so grateful to have you here today.
Hi, I am Abida Steenkamp, as Cara mentioned. I live in the beautiful Cape Town, sunny Cape Town. In 2009, I felt a lameness in my right arm. I then went to the local GP, and the GP, asked me the question, do you often work on the computer? And I confirmed I did. And she then gave me medication thinking I have some kind of an anti-inflammatory infection. Lo and behold, 2 weeks later, the pain was still there. And then I went to another GP, the one, who is actually my household GP. And I said, doc, I'm concerned. I had a shower this morning, and in the shower, while having a shower, I felt a little nodule in the right armpit. He then started to examine my breast, and when he felt the nodule, I said, that's quite painful. And he suggested, well, I'm going to send you for a mammogram. And I actually confirmed that I had been for a mammogram 3 months prior to that. He said, well, I'm going to recommend a mammogram once again, and also an ultrasound. So off I went to Morton and Partners, and once again, they did the mammogram, and they said, but you've been here 3 months prior to this. We don't see anything on the mammogram. So I said, well, there must be something wrong, because I have this little nodule or boil in my armpit. Anyway, I then proceeded on to have the ultrasound. And then when the radiologist started measuring my right breast, something tells you, something is not right. But anyway, these radiologists don't normally speak to you. So she continued to measure, and she measured under my armpit also. And then advised me to go wait in the waiting room until she types up the report. At the time, my husband was not here. He was overseas. And he then called me and he said, so how did everything go? You okay? And I just burst out crying. I said, I don't know. I think there's something wrong because they've been measuring my breast. Just pray for me. And then when the receptionist saw me crying, she ushered me back into the little cubicle at the back, and she asked me to wait there. And then the radiologist came over and she advised me that she had contacted my GP, and I have an appointment to see a specialist within 2 hours. Wow, I was shocked, you never get to see someone so quickly. But anyway, I tried to remain calm, and I went off to see the specialist. And while I was waiting in the waiting room, I think, my mind was a total blank. I just kept flipping the pages to pass the time. I couldn't concentrate on anything. Eventually, I saw the specialist who did a biopsy. A biopsy is normally where they first give you an injection and they draw some fluid from your breast. And then he drew some fluid from the underarm also, and that was quite painful. He then advised me to come back the next morning at 8:30, and he will discuss the results with me. I went home. I sat with my children and I said, I've just been to see a specialist, and I think there's something wrong. I hope and pray that it's not, cancer, but, let's all be positive and hope for the best. And I also phoned my siblings and asked them to do the same. My eldest daughter and my sister, felt that they would like to accompany me the next morning, and they did in fact do that. The next morning, the specialist confirmed that yes, I indeed do have cancer. I think when I heard the word cancer, I was just totally stunned. Nothing prepared me for that. I just went blank. I didn't ask anything. My sister and my daughter asked all the questions. I just sat there in total silence. I don't even think I registered anything else that he said at that moment in time. I know we eventually left, and when I got home, I went to sit outside in the yard, and I prayed that God must grant me the strength for the journey that lies ahead and help me. I know it's going to be a challenge, but I know I'm going to get through this, and I need to be positive. And that was the attitude that I adopted henceforth. My husband returned the following day, and he phoned the specialist, and he wanted to find out from the specialist why my appointment for the operation was scheduled only for the next Friday and not within that week. The specialist then asked him and the kids if they would like to come in, and he will explain to them. And off they went to see the specialist. He then explained, it's very important for me to internalize what was happening to my body, because they were going to remove my right breast, and I was never going to have a right breast again unless I opted for reconstruction, somewhere in the distant future. But we won't, talk about that. And I was then scheduled for the op, as I said, the following Friday. it gave me time to prepare myself psychologically. The next Friday morning, I went in at 12. I had the op where they removed the right breast. And when I came out of theater, the anesthetic that they had used had not agreed with me. So I was just, wrenching all the time. My body was shaking. They actually had to heap quite a few blankets on me to calm my body down. I think it was just the trauma of, everything that was happening to me. I asked my husband, not to let my kids see me this way because it was visiting hour that time. I recommended that he take them home and, it's best that they see me tomorrow when I'm feeling better. So during the night, I told myself, Abida, you are going to get through this. You need to be strong. You've overcome the first hurdle. It's not going to be an easy journey, but you need to believe in it and to embrace it. So the next morning, I asked the nurse to give me some jelly. And she said, no, you can't have jelly. I need to speak to the doctor because, you've been wrenching the whole night and we can't just give you anything. I said, my body is craving for jelly. I need the jelly. Please give it to me. I'm going to be okay. I then got the jelly. And yes, the jelly worked wonders for me. That's what I needed at that moment in time. I had the jelly and I felt good. I went to the bathroom. I had a good bath. When they say a bath, we call it a soldier's bath, where you try in your own way to clean yourself. And I put on my pajamas and my gown, and I thought, now I'm getting up, and I'm not going to sit in this ward all the time. I'm going to walk around slowly, and I'm going to take it easy, and I'm going to familiarize myself with the hospital. And lo and behold, at 2 p.m., when my family visited, they were shocked to see me waiting in the waiting room for them. They said, Mom, we can't believe you're looking so good. I said, yes, I am good and I'm feeling good. And that helped me. 2 days later, we celebrated our Eid. And that morning at 10 o'clock, my husband and the kids came to visit me in hospital. And we went down to the cafeteria and we ate the normal corned beef sandwiches that you have on Eid day. We had that and we had a cup of tea and some pies in the cafeteria. And my husband said, a house without a mother is not a home. We had to come to hospital because we need you to be at home with us. Be here for you all the way, my darling. Don't ever forget that. And I will always, always cherish that beautiful memory. And my husband was saying, this is the first time in his life he's ever bought a cup of coffee on a celebration day. But nevertheless, it was a small, small token, just to get through the day. 4 weeks later, I went to see my specialist, and then he confirmed that I have to see an oncologist now who will discuss my treatment plan. And I was referred to an oncologist. I opted to go to a female oncologist. I believe, they are very empathetic. This is no reflection on men. And I felt I could build a good relationship with the oncologist, and off I went. She then informed me the breast mastectomy that they did, all those goods that were removed, the breast and the nodules from my arm, all of those were sent away, and they do an examination, and from that, the results were that I had actually 2 very small tumors in my breast, but it was a very aggressive cancer, and it had spread to my nodules, and the cancer in the nodules, they had removed 7, and of those 7, 5 had cancer. So the tumor was greater in the armpit than in the breast itself, but because it was such an aggressive tumor, they had to remove the right breast. And the reason why it did not show up on the mammogram is because I was unaware of that. Some women actually have dense breast tissue, and a mammogram won't pick that up. Only an ultrasound will be able to detect those tumors. The oncologist then discussed with me the treatment plan. She said, the treatment will entail the first 3 sessions will be the normal red devil chemo, and the last 3 sessions would be septum and taxotere. So with the first chemo session, I was psychologically jacked up, everything went well, came home feeling good. With the second one, normally when you come in the chemo room, they soak your hand in lukewarm water to open your veins, and then they insert the needle. Now, nobody had given me the option to have a port. They probably assumed by looking at my hands, I've got good veins. But if anyone gets the option, to have a port inserted instead of having it done manually in your hands, I would certainly recommend that. So they insert the needle that's linked to the chemo. That's obviously attached to a stand, in a sachet. They insert it in your vein, and you stay there for sometimes it takes 3 hours, sometimes 4 hours, because they first flush the vein, and then they have the chemo running through. So I was craving for fish and chips. So my husband went to buy me some, and then I probably had just 2 pieces of chips and a small piece of fish, and lo and behold, everything came out, and they actually had to stop the chemo. And then I had to wait an hour, and they had to restart the chemo. So it's not a good idea, to eat while you're having the chemo. Rather have, something, probably a wafer biscuit or a salty crack, but nothing spicy. And that was a lesson I learned, and which obviously, I didn't eat in the following sessions. So between the second and third chemo, I actually started seeing the physical transformation happening to me. Whenever I used to comb my hair and I look in the mirror, I would see, some more hair falling out. I opted not to shave my hair because I wanted to see the physical transformation occurring. And by then, my taste buds had changed because chemo affects everything. I couldn't tolerate the smell of oils in my house. They couldn't fry anything in the kitchen. Some of the deodorants, would become very offensive to me. My favorite, Nando's, Kentucky, don't come near those things with me. It was difficult. And I practically lived off dry salty cracks and cream crackers in the morning, and weak ginger tea. My favorite, berry juice. I couldn't, tolerate the sight of that. It reminded me so much of chemo. And also, I tried, trial and error, various foods. After one bite, I can't stomach this. Oh, this favorite dish of mine. Oh no, too much, too spicy. No, just the look of it. Can't. So the only thing that eventually worked for me, we're all different and all our journeys are different. But the only thing that I could tolerate was pickled fish. I had pickled fish for lunch and supper throughout my journey. And that is what my body needed to sustain me. I remember that because, as I stated, my appetite had decreased. I didn't want to eat much. I ate very little. I had to be pressurized into eating. There were times when I actually did this. I said, I can't eat. Please don't force me to eat. And my children used to say, Mom, even if it's just a teaspoon, you have to eat. You have to regain your strength. Otherwise, how are you going to fight this? So, with the love and support, that really helped. You need that love and support from everyone around you. I had gone to my neighbors and I had informed them that I had been diagnosed. And I said, I don't expect anything of you. I just need your prayers and your support. And they were there. They used to pop in. Are you okay? Is it a good day? Is it a bad day? Is there anything we can do? Is there anything you'd like? And those are the things that really, really help. The love, the concern of others, open yourself to that. It's amazing. It really pulls you through the long, hard days ahead, because you do a lot of reflection and you pull on your inner strength, deep, deep down. So by the third one, I was really not doing so great in terms of, it's a roller coaster, your emotions are affected. So you don't even realize sometimes how it impacts on your family. So there were days when I would tell my children, I don't want to talk. Today is a duvet day. I just want to be left alone. And they would say, Mom, but we worry about you. If you don't talk, we don't know if you're okay. And my husband called our local GP in, and he came around and he gave me an injection and he said, Abida, you look so different. Why are you looking so different? And he said, oh, I see. You don't even have eyelashes and eyebrows. And yes, even that was gone with the chemo. So after managing the first three, I thought, well, I've overcome the first three, I know the next three is going to be tough, but I can get through this. I think the hardest part with the next three was, trying to swallow those 17 steroid tablets before I have the Acectum and Taxeter, because that was a much stronger chemo. And, you have to tell yourself, my husband used to sit with me and say, okay, you swallowed the first one. Okay, take a deep breath. Now you need to take the second one. And this is how it went. I hate tablets, but I managed to get through it. However, after you had your chemo, the next week you have to go for a blood test to see how you're coping as your blood count come up. And with the last three, my blood count went extremely low. With the result, every time I came back from the blood test, as soon as I got home, I got a call. You need to be admitted to hospital. Your immune system is too low. If you come into contact with anyone, whether they have a cold or hay fever, you could die because you don't have any antibodies. So I was admitted to a ward. I was in isolation. Whoever came to visit me had to have a mask on. That was very, very difficult for me, Sadly, my oncologist, she was busy, so with lots of newly diagnosed patients, so she often used to send her colleagues along. So not seeing a familiar face, did make it sometimes difficult. But you draw, as I say, on your inner strength, So I used to, every morning after breakfast, get up, think positively, take a walk through the hospital, go and sit in reception, say hello to whoever passes by. If anyone wants to chat, I'll chat. I needed to stay positive. So when I finished my chemo journey, I had a break of 6 weeks. And then the oncologist informed me that now my next step would be 3 weeks of radiation every day. Radiation was not as intense as the chemo. Yes, it does tire you, but you can still drive yourself. It is a bit daunting, lying there alone in a room, with your arm above your head like this, all alone, the room in darkness, and you have this big gun pointing towards your breast and then moving over to the armpit. It's a few seconds, but I felt, if I concentrate on positive thoughts and not dwell on, the impact of what this is doing to my body, then it's okay. And that's what I did. And this is how, I managed to get through every day. And at the end of the journey, when I finished my radiation, 3 weeks of radiation daily, I saw my oncologist once again, and I excitedly asked, so what is the next step? Am I going on tamoxifen? Tamoxifen is the cancer hormonal suppressant tablet that the doctors put you on. Initially, it used to be 5 years. Now they put the ladies or men on it for 10 years to prevent the cancer from recurring. And she said, no, the type of cancer you have, HER2, it's like putting diesel in a petrol car. It's not hormonal related. So my advice to anyone that is going on this journey or has just been diagnosed, cancer is certainly not a death sentence. There's hope. And yes, I am living proof. I'm still here today and I'm grateful for that. Enjoy the beauty of life. Don't stress about the small things in life. And make time for your family, and make time for yourself. Go regularly for checkups and, appreciate your body and the beauty. And you don't have to feel any different just because you no longer have one breast missing. I still feel as beautiful as ever. And I thank my creator for that. So thank you. That's it, Cara. I'm handing over to you.
Thank you so much, Abida. I think, wow, is there ever really enough time to really share someone's full journey, especially because cancer is not a simple process. And I think, Abida, it's definitely something that we can just take from you is just that positivity. And I think that really did make a difference to your journey from the beginning, just getting out of bed, having that soldier splash and getting your pajamas on and going for a stroll and just deciding mentally that you're going to be in as much control as possible of the situation instead of the other way around. So thank you so much, Abida, for your bravery and your kindness. And I think it's really that infectious personality and kindness that is really helping so many people on ground level. We know with all of your patients and the community work you're doing, we're so grateful to have you on the team. And I really hope that everyone here just enjoyed her story, and also the power of family and the power of that incredible support. And that's actually something my colleague Gretchen will actually chat with you all about shortly. I think for a lot of people here, maybe you don't have a family member with cancer, you don't know anyone, but it doesn't mean, I think as Fatima said earlier, someone you love in the next couple of years could be affected. And it's the most common question we get asked actually is, how can I support someone, or what should I do? And I think Abida is definitely one of the blessed ones to have such an incredible support base that really helped her along the journey. So thank you so much, Abida, for sharing with us. I'm now very proud to introduce you to one of our cancer service specialists. She's a professional nurse and has been so for the past 45 years. Her name is Olivia Curlewis, and she's an integral part of Cancer's national service team. She's actually been with Cancer for 25 years, and she's been dedicated with patient care, palliative care, and working with caregivers, etc. She runs quite a few fleets of our patient work in Gauteng and Northwest and Limpopo. She is very committed and very passionate about early detection and women knowing their health. She is a fantastic woman, and I'm going to introduce you to her now. So over to you, Olivia. Thank you so much for your time today.
Thank you, Cara, and thank you for allowing me the opportunity to empower each and everyone on this webinar today. Early detection is absolutely vital. It is so vital. You need to know your own body. Do you know that 1 in 26 women are at risk of getting breast cancer? 16% of cancer deaths are attributed to breast cancer. That's scary. Every woman and every man should know their own body. You need to take responsibility for your own body, because only you will know your own body. And therefore, you need to know what are the warning signs, Because if you know what the warning signs and you practice knowing your own body, you can detect, and that early detection leads to a better prognosis. So the warning signs, we have puckering of the skin. You know, you've all seen an orange peel. It makes those little dimples like an orange peel skin. That, if you suddenly see that breast, it's never been there before, and you get this on your breast, that is a warning sign, because it could be something behind that's pulling in. A lump in the breast or the armpit. Remember, our breast tissue starts right under our arm. So we need to feel under the arm. As Abida said, she felt the lump in her armpit. A change in the skin around the nipple or a nipple discharge. There should never be a nipple discharge unless you are pregnant or breastfeeding. A dimpling of the nipple or a nipple that's retracted. Some of us are born with retracted nipples. So therefore, it won't be a sudden change. But if you've never had retracted nipples and suddenly your nipple retracts, it could be an indication that something is growing behind the nipple, pulling it in. An unusual increase or shrinkage of the size of the breast. That's why Abida said that she, they started measuring that. And that's why when you first do when you start doing your self-breast examination, you need to first stand in front of a mirror and look at your breasts. And our breasts are never symmetrical. Sometimes one is bigger, a little bit bigger than the other, or one might hang a little bit lower than the other. But that's totally normal. That's the way we're born. But if there's suddenly a change where the one becomes much bigger than the other one, or it's beginning to hang a lot lower, then we need to know that that is a warning sign. An enlargement of the glands under the arms and an unusual swelling in the armpit. Those are all warning signs. And we need to know what are these warning signs so that we can be a thing. Then there are risk factors. There are always risk factors. How do we decrease our risk factors? Being overweight and low levels of physical activity. Those are all put you into a risk category of getting alcohol and tobacco use. Very important. It's not only lung cancer that gets caused by tobacco use. A lot of cancers. And I mean, there's such a long list of them, I'm not going to go into detail. But breast cancer is one of them that puts you at risk if you use tobacco. A family history. If you have a mom or an aunt or a sister or a grandmother, and that applies to the men as well, because remember, men also get breast cancer, as Fatima mentioned when she opened. Yes, the percentage is much lower, but they do have breast tissue, so they can get breast cancer. If you have a family history, remember, breast cancer is genetically linked, and especially if you have the HER2 cancer. So you need to, if you know that family history, you need to be more parot. You need to do your breast examination. Women who have never had children or only had their first one over the age of 30, unfortunately puts them into higher risk. And what's happening today, women are becoming more career orientated. So they are having children at a later stage. And unfortunately, physiologically, that puts women at a higher risk to develop breast cancer. Breast cancer does not discriminate. All women and men, doesn't matter what your creed, race, gender, it doesn't discriminate. Breast cancer, as long as you've got breast tissue, you are at risk of getting breast cancer. So how are we going to do our breast examination? Now, there are three very easy steps how to do it. And we're going to show you a beautiful video. But just before we show that video, as I said, before you do that breast examination, stand in front of a mirror, look at your breasts. Then you can do it either lying down on a couch, on the carpet, on your bed, in the bath, in the shower, make your hands nice and soapy, and do the breast examination. So it's three easy steps, and you can see that in the video. Each one of us need to take charge for our lives. We've got to be advocates. What you've learned today, you've got to take this and go and teach other people, because it doesn't help if you keep this information to yourself. So spread the word, empower people around you. Ladies, it's time to make a difference. Go out there, and take this information and teach other women how to do breast examinations, because early detection leads to a much better prognosis, and breast cancer can be cured if detected early. We're now going to show you our beautiful video. Thank you.
It might not be a lump. It might be puckering, dimpling, breast or nipple changes, swollen glands, or yes, it might be a lump. Breast cancer is the most common cancer among South African women, so it's important to examine your breasts on the same day every month, 7 to 10 days after your period. If you no longer have your period, choose a day that's easy to remember. To do a proper breast self-examination, follow these 3 easy steps. In front of a mirror, check for any visible breast changes in 4 different positions. First, with your arms at your sides, then overhead, then firmly pressing your hands on your hips, and lastly, bending forward. Lie down on your back with a pillow under your right shoulder and your right hand under your head. Starting below the collarbone, make small circles by pressing down, moving clockwise towards the nipple. Remember to check under the armpit. In the shower, check your breast with the soapy left hand and fingers, using the same technique as lying down. Always repeat these 3 steps on both sides. Tell your doctor if breast cancer runs in the family. After the age of 40, make sure you have a mammogram every year. Cancer care centers offer clinical exams by professional nurses. Early detection can save your life.
Thank you so much, Olivia, for sharing with us. And I think you really brought some. I don't think there's ever been someone that has been so excited about how to do a breast examination. And I think that really speaks volumes for CANSA as an organization. We are really so passionate about women and men knowing their bodies, knowing the signs and symptoms, and making better choices. So I hope you enjoyed our video. We have sent that through to your fantastic marketing team at DHL, and they should be sending it out to you guys as well, so that you can have it and share with loved ones and colleagues. I think it's just so important just to get the conversation started. I know it might not be the most fun conversation. In South Africa, we have braais, they're on the barbecue, at dinners, at social events. But unfortunately, someone has to start the conversation, and we need to ask each other, are you doing your monthly self-breast examinations? Have you been for your mammogram? And are you taking care of yourself? And if we can start those conversations, we can definitely see that women all around the world, and as well as men, will have better treatment outcomes and will not have such hard cancer diagnoses and prognoses. So thank you so much again, Olivia, for your passion and for just really giving so much energy and for explaining so simply and so well those simple steps that people can do. Thank you so much. I'm now going to be handing us over to another one of my wonderful colleagues. Her name is Gretchen Minnar. She is the Cancer Services Manager for Psychosocial Support. That's basically all of cancer's counseling support services, from our support groups to individual family counseling, tele-counseling. She's responsible for all of it nationwide, so she's definitely a busy lady. She has been a social worker for 16 years and a cancer for the last 10 years. And she's going to be sharing more with you, with all of you, about how to support someone that you care about or someone that you know that has cancer. And from her insights and years of experience, we know that she's going to make an impact on you. Thank you so much and welcome, Gretchen.
Thank you, Cara. So if a family member, a colleague, a friend gets diagnosed with cancer, there are a number of things that you can do to support the family member or friend or colleague. Today, I'm going to touch on the tactical support, the emotional support, and it gives me great privilege also to introduce our cancer resources to you. So support for people living with cancer. We're going to touch on how can we as cancer help patients and their families. Thank you, Emmanuel. Thank you. So Our first slide is on our iSurvivor online support program, as well as our iSurvivor online support program for metastatic breast cancer survivors. This is one of a kind in the world, where it's an online email program and it's free of charge. And these courses has been written by breast cancer survivors themselves. The iSurvivor program was written by a 20+ survivor, and the iSurvivor program, of course, was written by metastatic breast cancer survivors to help other metastatic breast cancer survivors to cope during their journey. Thanks, Emmanuel. We also have at-home pain guides. I think during lockdown we experienced that because of COVID, patients were isolated. They didn't visit their doctors and hospitals as regularly, but they still experienced pain at home, and this caused the stress to the family members. And then CANSA released our Cancer at Home Guide for children with pain, and also our Cancer at Home Pain Guide for adults. And this was to relieve the burden or the stress on the family members, and it also guided the family members and caregivers on how to manage pain at home. This is a valuable guide because we do have patients that stays in rural areas or in areas which don't have a lot of resources, and this guide meant a lot to them as it navigated the family members, the caregivers, through the on how to manage pain at home. When I listened to Abida's journey, she mentioned a lot on one of the side effects of treatment that she experienced, the nausea, and also tips on how she handled that. And this is what we want to do at CANSA. We want to prepare the patients before they start their treatment. We want to guide them during the treatment and after the treatment when they do experience these side effects because of the cancer treatment. Diarrhea, loss of appetite, nausea, which also result in patients that don't want to eat or they don't know what to take in. So CANSA has our dietary tips, which is the guideline and tips on how to manage the common side effects of cancer treatment, like Abida said. When you experience nausea, stock up with your ginger products. So when patient comes through our health desk or info line and they are struggling with side effects, we do have guidelines on how to cope with these side effects. This can also be accessed on our website, www.cancer.org.za. It's under our services section, and you will see under dietary tips all this valuable information on how to handle these side effects. Then we have our cancer coping kit, which is valuable. It's available as a physical copy. We have it in PDF booklet form, and then also on our website as an audio download. And when I listened to Abida's story, she said the first emotion or reaction that she experienced was shock. She didn't hear anything further that the doctors informed her about her cancer diagnosis, and luckily she did have family members that was with her at the hospital. But this cancer care coping kit, we do give this to family members that can access this on our website, and on their own terms and in the comfort of their home, they can come to terms with the diagnosis and also the treatment and how to cope with this cancer diagnosis. This coping kit covers what is cancer, what is chemotherapy, what is radiation, the nutritional value and dietary tips, as well as how to cope with cancer disease. Thanks, Emmanuel. So for our cancer help desk, we have passionate, compassionate staff members that is manning our help desk. This is really a lifeline for a survivor, a cancer patient, for caregivers. When they have nowhere to turn, people contact our cancer toll-free line on 0800 22 66 22 for clinical queries, for any non-cancer specific related queries, really just for any concern or challenge that they do experience for their journey. And then we will navigate or direct them to staff members, social workers, nurses that can assist them and guide them with regards to their cancer journey. It can also be accessed on info@cancer.org.za or for our telecounseling, which is offered in South Africa via counseling@cancer.org.za. And then we also, just to accommodate everybody, we also offer this service via WhatsApp. So on the screen, you will see our WhatsApp numbers for English and Afrikaans, and then also for Xhosa, Zulu, Sotho, and Siswati, where patients or caregivers, friends or colleagues can put down their request for service, for support, or any challenges that they experience. Our cancer fact sheets, presentations, and infographics are information, general information on cancer, types of cancer, carcinogens or cancer-causing agents, and also how to lower your risk, the myths of cancer. So it's information of a certain cancer, and we also get a lot of queries where patient gets diagnosed with breast cancer and they want more information to empower themselves and to take control of their cancer journey. So these information, these fact sheets, our presentation and infographics are also accessible via our cancer website. And I think this is very important, how to be a friend to a cancer survivor. Sometimes friends, family members stay away because they don't know what to say and they don't know how to assist a cancer patient. So there are practical tips on how to assist a cancer patient. Everybody wants to help. Instead of asking the cancer patient, how can I help you? Offer your assistance. Offer transportation for their children to school. Offer transportation for the hospital visit, because it can become a financial burden if they have to cover a far distance to the hospital. Offer to cook for them meals, for instance. The cancer survivor don't have the same energy every day. Today they might feel great, tomorrow they might feel lying in the bed the whole day. So offer your assistance with a meal for the family or doing their washing. These are some practical guidelines in how you can assist a cancer survivor or to be there for a family, friend, or colleague. Also be aware of what you are saying to the patient or the family member. Avoid saying, I know just how you feel. We can never truly understand how another person is feeling or thinking, and we should not delude ourselves into thinking otherwise. Don't encourage patients to talk if they are not ready to talk. They first have to accept the cancer diagnosis, and then they will say, I'm ready to talk. Rather say, if you need to talk, I am here. Or if you need somebody to talk, contact the Cancer Association, which has trained and professional social workers who can also assist. I know just what we should do. I feel helpless. Rather say, I am here for you. Or what do you feel like doing? Sometimes patients don't have the energy to go for a walk, but they really want to get outside So offer a ride with a car instead. So that are some of the practicalities in how to assist the cancer patient. Thank you, Emmanuel. Then we also have Facebook support groups for our cancer survivors, which is called the Champions of Hope. For our caregivers, the caregivers are not only the medical personnel, the nurses and the doctors. The caregivers, when we refer to the caregivers, we are referring to the people that is supporting the patient at home, the friends and family members, and we know that they also need support and might burn out. So we do also offer support to our caregivers. Our Facebook group is Caring for the Caregivers. And then we have a childhood cancer support Facebook support group. Our program is Tough Living with Cancer. And our Facebook support group is then called the Cancer TLC Childhood Cancer Support Group. And this is just a platform for patients and family members to share their story and to offer support to their fellow survivors and caregivers. Informative webinars. I think when COVID hit us, we started with our webinars to get the information out, roundtable discussions, panel discussions, webinars, still informing and educating and empower patients as well as caregivers with information, valuable information. Our cancer support groups, we have face-to-face support groups, and we also have virtual and online support groups. Our Cancer Netcare support group started as a face-to-face support group, and then COVID struck, and then we launched our virtual support group. We had 5 sessions already, very valuable sessions. It's on the last Saturday of the month, on the 4th Saturday of the month. We invite a speaker, and then we also take up cue from the patients and the caregivers. We ask them to email us also to our helpline with suggestions on topics that they do prefer, and then we will arrange the speaker accordingly. We also have support groups in South Africa, in our different towns, and then we also have WhatsApp support groups where we then can link a patient or a caregiver that is in need of a support group or a specific support group. Thank you. That's all from me. Thank you, Cara.
Thank you so much, Gretchen. I think that is a lot of information, but I think it's really good to know that there are options. One of the biggest challenges a lot of cancer patients are facing, they feel alone, they feel isolated, and they don't know where to turn to. And having, or just I think knowing that there is so much support out there, especially from cancer, there are resources that are trustworthy, that are researched, that are available to you. You and your family do not have to be alone, especially a lot of people living far from treatment centers. It plays a massive role in what your accessibility is on your community level. So I think from CANSA, we'd like to thank you so much for joining us today. We're so grateful. We had about 50 participants today. Thank you to my wonderful colleagues and speakers. And please note you're not alone. Even if you aren't in South Africa, we can assist as best we can with our materials. Don't forget about www.cancer.org.za, and we'll make sure that we send a lot of information through to the DHL team to make sure you guys can have access to that. So thank you so much from our side for this opportunity, and we really hope you learned something. I'm now going to hand over to Fatima. Thank you so much, everyone, and have a wonderful weekend.
Thank you so much, Cara, Abida, Olivia, Lucy, Gretchen, Emmanuel. There's so many people. With things like these webinars, there are always so many people involved to make it work. I think for me, it's always so incredibly touching to hear all the different stories from the survivors. And, you know, just a reminder, once again, that, you know, our physical and our mental well-being is absolutely vital, and we are all responsible for looking out for ourselves. The worst thing that we can do is putting ourselves last, which is what we very often do. So I just want to thank everyone for taking the time to join today. But last and not least, I want to thank the absolutely fabulous DHL for her team. Melissa, Carmen, Stan, you guys have put together an amazing awareness month for us. You've really gotten a lot of information out across the continent to help all of our people and to improve the knowledge with all our staff, etc. So thank you for everything that you've done. But also just a reminder for everyone on here that we are, and we have decided to take a long-term partnership with CANSA. They are an organization that have been leading in the research and in the support of all people, you know, struggling with all different kinds of cancer, and they've done so for 90 years. It's a phenomenal achievement, and as I mentioned earlier on, before we went public on this webinar, Cara, Gretchen, you know, Lucy, all of you guys, Olivia, we absolutely appreciate what you do on a daily basis. The world needs many more people like you, and we really hope that the care packs that the DHL team sponsored this year and put together will go some ways to helping ease the traumatic time that the cancer sufferers go through. I mean, Abida really made me feel what it was like for her, and so hopefully a little bit of love from the DHL people and the DHL Yellow Machine will go a long way with these people. So that's it from me and from the DHL for Her team in SSA. Thank you, everyone. Thank you for being here, and thank you, CANSA. And very happy anniversary to you. Goodbye, everybody.
A little lost, and it's alright, it's alright. It's alright, it's alright, it's alright. I wrote 100 pages, but I burned them all.